Hemophilia is an inherited disorder mainly affecting males, but there are females with severe hemophilia. It's either Hemophilia A, which is factor VIII deficiency, or Hemophilia B, which is factor IX deficiency. So we are developing a drug for subcutaneous treatment of factor IX deficiency. But at this meeting, we are developing a drug when patients react to their factor, either the 8 or 9 that they're given, and they make neutralizing antibodies, so-called inhibitors. So clotting factors no longer work. So this is a very difficult population with a high morbidity because good prophylaxis does not exist for Hemophilia B with inhibitors. Recently, there's a drug approved that has substantially improved the treatment of A with inhibitors, but they still bleed. So we are looking to have a drug which eliminates bleeding with good prophylaxis, or the same drug might be able to treat a bleed subcutaneously when patients have a bleed. We've been running a phase 2 study globally in patients with inhibitors, and we record their bleeding for the prior 6 months, and I've been staggered to see just how much mayhem that is, using the real meaning of mayhem, which leads to destroyed knees, hips, even amputations in these patients. So we record this. Patients need an annualized bleed rate of 12 or more to get in, but many of our patients have been up to almost 27 bleeds a year. And in the past we thought these were just one-day bleeds and they responded to treatment, but I've been amazed to see how some patients, despite treatment, are bleeding for up to 9 days at a time. They enter our study, we do pharmacokinetics, and then we start at the lowest dose, 30 micrograms per kilo. It's injected subcutaneously every day at the lowest dose. If they don't bleed for 50 days, they're done. We've eliminated their bleeding, and 3 patients who we've enrolled have eliminated their bleeding at 30 micrograms per kilo. One patient almost got there, he had a bleed on day 46 and graduated to the next highest dose of 60 micrograms per kilo, and then he went his 50 days without a bleed. So this is substantial reduction. We've looked at patients who've gone from 20 or 22% of bleeding days. Imagine bleeding every 5th day of your life on average, and we've taken them down to 0 in 3 patients, or 2% in one, or 4% in another. So very exciting reduction in bleeding or elimination of bleeding in patients with inhibitors. That drug is called Marzeptacog Alfa activated, and it's a recombinant ultra-potent factor VIIa that was engineered by our company. Our next steps are to do the confirmatory phase 3 pivotal study globally to satisfy all the different opinions amongst regulators all across the world, so that we can register the drug for use in all territories. Factor VIIa is used to treat a number of conditions. It's used to treat breakthrough bleeding in patients with inhibitors, so-called bypass agents, but there's also factor VII deficiency, which has inadequate therapy today. There's also acquired hemophilia with patients here for the meeting, cancers predominantly, who then develop as a side effect antibodies against factor VIII and get acquired hemophilia. I've developed prior treatments for the disease, but there's still a lot of room to improve the treatment of acquired hemophilia. Our primary target is Hemophilia B with inhibitors, because there really isn't a drug that treats effectively B with inhibitors. I've been doing research in the hemophilia space for a decade and a half, and I've been astounded at just how severe the impact on the quality of life is. We need to do better. We need to have higher targets such that we eliminate bleeding. I know it's a difficult aim to have, but we owe it to our patients.